I'm your host, Dr. Suzette Sutherland from the University of Washington today, and I'm excited to have Dr. Ann Cameron as our guest. So there are some other ones. You are getting into those things, talk about cranberries, talk about Hiprex, and other kinds of things that are available out there.
Sure. Cranberry supplements are on the AUA guideline since there is good quality evidence to suggest that they work to prevent UTIs, particularly in the voiding female population. There's also some studies in children with recurrent UTIs that show that a good quality cranberry product taken every day can reduce your risk of urinary tract infections with minimal side effects. Cranberry supplements can cause a little bit of GI upset, but by and large, they are pretty easy to take, pretty well tolerated. And if you get a good quality cranberry product, that is one where they have removed much of the acid from the product. So then those are safe to take with anticoagulants like warfarin, and those are safe to take in people who are recurrent stone formers because the acids in cranberries are pro-stone forming and we don't want to be causing new problems.
So when we look at the cranberry supplements then, well, first of all, let's look at patients say, well, what should I be looking for if I'm looking at a cranberry supplement? There's so many that are out there. Are there certain ones that work better than others?
So some cranberry supplements are simply powdered cranberries. So they take cranberries, they powder them, and they put them in a capsule. That is a very simplistic approach to cranberry supplementation. And again, those cranberry supplements have interactions with warfarin and they can cause kidney stones, and they also have a lot of acid present in them which can irritate your bladder. So that's not a high quality cranberry product. What we like to see are soluble PEC, and you want it at a high enough concentration that it's going to be effective. So the products that I recommend to my patients are Ellura, which is the company that has really led the stage in the studies on cranberry supplements. Most of the literature out there actually used their products when they're making recommendations about cranberry. And many of the other companies have used their data and said, oh, we have the same product. But again, it's not quite that simple. The supplements and the way that they're processed can be different. So I recommend Ellura, and I also recommend TheraCran based on available literature that supports use of those specific products. And as we all know, nutraceuticals are not regulated by the FDA. So you have to be really careful about which ones you use and which ones you buy, because you need to ensure that you're actually getting what's on the label. And the only way you can do that is by using a trusted product.
The two buzzwords that I use to talk to patients about cranberry supplements is you mentioned PAC, proanthocyanididine. That's what that stands for. That is the active compound in the cranberry, whether you eat a cranberry or take a cranberry supplement, but that's the active compound that needs to be in the cranberry supplement. And you need to have enough of that active compound for it to be effective, just like anything. And the dose that seems to be effective is 36 milligrams, and that's what's in one tablet of the product that I often recommend is Ellura for the same reasons that you mentioned them. And that has 36 milligrams. So we find 1 to maybe 2 at a time if you're having some symptoms you think might be UTI-like. But more than that at a time has not been proven to be effective. So the usual dose is 1 once a day around the time of susceptible events such as sexual activity or things like that. So the first buzzword is really the potency, right? Is it strong enough to be effective? And the other is it soluble? And is the body able to utilize it? To your point, you take a supplement, if it doesn't get absorbed well, then it doesn't matter if it was potent when it wasn't absorbed, because it's not absorbed and it's not helping you. And so we know that soluble PAC is very bioavailable. It's readily used by the system, and you're getting then what the pill is meant to deliver. And so that, again, is that product, Ellura, where they've done a lot of basic science research in this area. I believe TheraCran has also done some research, and another product out there, UTI, is hitting their marketing campaigns. I'm not as familiar personally with the UTI data and how soluble that compound is. So those are the two things to look at. So when you look at a lot of these other products that you can get online or over the counter, they don't even mention PAC, let alone anything about their solubility. I loved what you mentioned. You used that term financial toxicity, right? And so, of course, if you're buying expensive supplements that aren't even going to be working, then what's the point?
Yes, and the other comment I get from patients is, oh, well, I drink cranberry juice. And drinking cranberry juice to treat recurrent UTIs is kind of a full-time job if that's what you're doing, because you do need to drink the cranberry concentrate. You actually have to drink quite a bit of it. Even the unsweetened version, you're probably getting close to 600 or 700 calories of juice per day just to get enough to reach that level of a PAC concentration. And if you're drinking the cranberry cocktail, then we're really talking about liters of cranberry cocktail a day. So that is really not a good strategy. No one wants to consume an extra 700 calories per day. And in your diabetic patients, now we're really getting into trouble where they're drinking simple sugars, and their diabetes being poorly controlled is probably going to lead to more UTIs. So I really don't recommend the juice to any patients, although you can achieve the dosage. It's just not sustainable.
Yes. And it's also can be very expensive. The pure cranberry, they have a sugar-free one at Trader Joe's, but it can be very expensive. Again, so back to the financial toxicity. So those are great points. Thank you. So let's look at the Hiprex.
Yep.
And vitamin C. Can you speak to that? If the cranberries aren't working, the other things you've done, and when do that's something that's been available for so many years, and it's coming back a little bit, I think, into modern practices. And why don't you speak to that a bit?
So methenamine Hippurate is an old medication. It's been around for a really long time. It is metabolized and converted into something similar to formalin. It's not formalin, but it's basically an antiseptic. That is, when it's excreted and concentrated in the urine, it will kill bacteria. The methenamine literature from 20 years ago was relatively poorly controlled studies. They didn't have great control groups. They didn't report their outcomes very well. So people really poo-pooed the results of the methenamine literature. But in the last 5 years, and this didn't hit the AUA guideline, in the last 5 years, there have been several really well done, large randomized control trials with a placebo arm comparing methenamine to other things. And the results were very, very good. So the results showed very little toxicity and showed a significant decrease in recurrent UTIs. So based on this new literature, which in my mind is going to get incorporated in the next guideline version because it is such high quality, I do definitely recommend the methenamine. If you prescribe the methenamine Hippurate, you don't actually need to combine this with vitamin C because it is already acidified. The medication needs to be acidified to work, and the vitamin C will do that. So the methenamine Hippurate version of it will acidify itself. But I'm a big believer in this medication, and I have many patients who do take it. And again, it's a non-antibiotic strategy. You can't get resistance to an antiseptic because it's not an antibiotic.
Yeah, that's such a great point that you can't develop a resistant organism on it. What's your overall strategy when you talk to a young woman or postmenopausal woman having some issues with recurrent UTIs? What's your package that you just recommend?
So at the start, I make sure that she really is having urinary tract infections because interstitial cystitis and other bladder conditions can mimic this. But if I'm convinced that these really are urinary tract infections, we have positive cultures, then I make sure that she is emptying her bladder. I do that with a post-void residual. That's easy. I will do a vaginal exam because I want to assess the estrogen status of her vagina. And I want to look for things like a cystocele that might be impairing voiding. I also check for a urethral diverticulum that can be a source of recurrent UTIs, and also assess her voiding habits with a history. How often is she going? Is she emptying her bladder after sexual intercourse? You don't need to urinate before you have sex, but you do need to pee afterwards. I often ask them about their bowel habits and their wiping habits, and as well as their hygiene habits, because many women, although they won't tell you this up front, are doing very aggressive hygiene measures that are really not helpful. And I really emphasize here that I also try to destigmatize recurrent UTIs. Many of these women think that they are doing something wrong. They think that they are dirty, that they are themselves the cause of these UTIs, because that's what's out there in the lay press. I really try to reassure these women that the more they wash, the more they douche, the more they soap, the more UTIs they are going to get. This is not their fault. They have a risk factor, whether it be a genetic risk factor or a hormonal risk factor that's causing these UTIs. And I really try to take the blame away from them. It's not the way they're wiping. It's not the way they're urinating. This is just bad luck for that poor woman. And my first education piece is hydration. And if she has a low estrogen state in her vagina, my first step is to introduce vaginal estrogen, either via the cream, the ring, or the tablets, because this has excellent evidence to support its prevention of recurrent UTIs and restoration of the normal vaginal flora. This also has positive side effects such as vaginal comfort, decreased vaginal symptoms, and better comfort with sexual activity. So this is a win-win strategy. In other women who prefer to avoid estrogen products, I will then discuss the supplements, and that would be either the Cranberry supplements or the Methenamine. Those would be my starting point for those patients. So that's where I start. And I go over good practices. So good hygiene practices are things like urinating after sexual activity, after having a bowel movement, using a different piece of tissue in the front and in the back. But there's front to back to front wiping really doesn't matter. That's been proven to not really be impactful. And I really just try to destigmatize it at this point in time.
Thank you so much for listening. If you haven't already, make sure to follow the podcast, rate it 5 stars, and share with a friend. If you have any questions or comments, direct message us at _BackTable OBGYN on Instagram, Twitter, or LinkedIn. BackTable OBGYN is hosted by myself, Mark Hoffman,
and Amy Park.
Our audio team is led by Kieran Gannon, with support from
Josh McWhirter,
Aaron Bowles, Nick Shellcross,
and Ness Smith-Savadoff. Design and digital marketing led by Brian Schmitz, with support from
Taylor's Version Hess and Yvonne Overjinsky.
Show notes and social media by Jody Lenora.
Administrative support provided by Jamila Kennebrew.
Music written and performed by Scott Baby Daddy Hoffman.
Thanks for listening, and we'll see you again next time. The views and opinions expressed by the hosts and guests on